Can you kind of tell the difference of influenza and coronavirus?
So first, there are two different kinds of viruses, right?
Hmm.
We classify viruses in ways that we don't need to talk about, but flu and corona are really different viruses. Although they both infect the respiratory tract, they have a different chemical makeup and they have a different biology. But they both will infect the upper tract. Typically, you inhale them, and then you have this upper tract here lined with cells that is a really good place for viruses to reproduce. Then the virus moves down into the back of your throat, you get sore throat, you get coughing. And so flu and coronavirus so far look pretty similar. In fact, even the time course is similar in terms of infected, then within a few days, you may show symptoms.
Hmm.
Most cases, and influenza tends to move down into the trachea, right? Which is the first part of your windpipe is the trachea. And then you go down into the bronchi, and then it splits into the lobes of the two lungs. Influenza typically goes down into the trachea and reproduces in the cells that line that tube. And you typically feel like a pain, substernal pain, it's called, with influenza. But most cases don't go down into the lower parts of the lung. They don't cause pneumonia, although they can, especially in elderly people. Flu virus can go all the way down into the alveoli, which are the air sacs of the lung, and wreak havoc there, and you get viral pneumonia. But what flu doesn't do, the coronavirus does the same thing, enters the upper tract. You get a common cold type syndrome. It can go down into the lungs and cause havoc in the lungs. But most people resolve the infection unless you're older or have comorbidities with
Right.
coronaviruses. But what coronaviruses do that most influenza viruses do not is that they cause this incredible inflammatory disease. And that's where the severe COVID comes in. Most people have a 2-week viral illness, they recover, but then other people go on, their virus is clearing, but then they have trouble breathing. They go into the ICU, they get put on oxygen, and they can die. And all of that serious COVID is because of your immune response.
Hmm.
And we don't often see that with influenza virus. Influenza virus is largely a virus-driven disease. There's some role of immune responses in the trachea, but we don't see that systemic, which means involves your whole body. With coronavirus, right? Not only you can't breathe, but you have intestinal problems, you have neurological issues, you can have a skin rash and so forth. The virus, it's not actually the virus that's doing any of that. It's your immune response. So we call that an inflammatory disease or cytokine storm.
Hmm.
We are overreacting to SARS-CoV-2 infection, and that causes the most serious disease. It's not actually the virus, and it's not everyone. It's older people and people with comorbidities. We don't quite understand why that happens in a certain fraction of people. I would say that's the biggest difference between influenza virus and SARS-CoV-2. They're both respiratory viruses transmitted in a similar way by respiratory droplets, but then that late disease in COVID and also long COVID is unique.